So here we go. Unmuted. Thanks, Zoom. Super helpful. Welcome to July podcast recording. Happy to be here. I'm going to start seeing if anybody comes on the webinar. I want you to type in the comments if you want coaching. I'm going to do some question and answers that I get on Instagram Live. So here we go. Number one, love your podcast. Thank you. Have you ever seen anyone get hives from a compounded estrogen cream? So the compounded estrogen cream is, first of all, what does compounded mean, right? So compounded means it's made in a compound pharmacy where they're actually able to make up the product there. It's not standardized. It's not usually FDA approved, which means your insurance doesn't usually cover it. But it's nice because you can get different formulations or bases made in the cream. You can actually, what you can do at my compounding pharmacy, so I'm just assuming this is all compounding pharmacies, is you can actually get them to give you just the plain bases that they'll put the drug in, right? So like if I want to compound an estrogen cream, I can actually have a lady go to the compounding pharmacy and be like, give me all the bases that would actually work for the estrogen cream. And then they can kind of go home, put them on their vulva, put them on their skin, see if they tolerate them. And then they can pick the one and be like, I want this one to put the estrogen cream in. So the question again was, have you ever seen anyone get hives from a compounded estrogen cream? Personally, no, I haven't, but just know that compounded estrogen cream is going to be dependent upon what your pharmacist base, it's called the base, is used in, and you might have some sensitivities to it. What I have seen with the prescription product is there's an alcohol base in there, which can be really irritating to any sort of dry, atrophic, kind of chapped lip skins. So that's my two advice for estrogen is number one, if it's owy and burny, you keep using it for a while, meaning like 6 weeks, because it's kind of like rough or sensitive skin. Like as it heals, because estrogen cream on the vulva is literally going to start healing your vulva and creating healthier skin, is that it will become less and less sensitive the healthier that skin is. So option number one is just stick with it for a little bit to see if it's going to help. And then if it's still after about 6 weeks, you're like, this is super fiery, and now I kind of hate my doctor because she's made me do this for 6 weeks and it still is bothering me, then I would say go to your compounding pharmacy, get different bases there, and then see which one is tolerated better for you. So I will put sensitive skin people from the brand name to compounded. But again, downsides of compounded is cost not covered by insurance. My compounded vaginal estrogen around me is around $60 a tube, which is just about as cheap as the generic estradiol cream is going to be. So for anybody who is live on the webinar, welcome. If you want live coaching, type coaching in the chat box. I see Dr. Krant is here, which is so awesome. If you want to chat about anything, shoot me your topic and I'll pull you on to do some chat about something. Otherwise, I'll just keep answering questions until I hear from you guys. So next question, troubleshooting birth control pills, oral contraceptive pills, and low libido. I have a patient who notices a significant spike in libido on her pill-free days. So she had the same on ortho tricycline, so they tried a couple of different oral contraceptive pills. She takes it for acne and hirsutism. Hirsutism means kind of unwanted hair growth. And then going off the OCP is not an option for her. I know you're not an endocrinologist, but I thought it would be a cool topic to explore. So oral contraceptive pills work by basically mellowing out, or if you want to use a trendy word, balancing your hormones, kind of flatlining them. Without oral birth control pills, women's hormones go up and down and up and down and up and down until you hit menopause, and then it's just down. So what you see there is when more than likely when she's on her pill-free days, her natural testosterone it goes up, so she might be feeling more of a libido that way. We don't think estrogen is actually a huge libido driver. Estrogen can be better for responsive or receptive to intercourse, especially in rat models, but testosterone is really the spontaneous desire hormone. And remember, you guys, desire is very complex, right? So I'd hesitate for anybody to be like, I need this, I need that. Is like, it's still very complex because sexual function is biopsychosocial. What that means is it's biologic, it's psychologic, and it's your social environment that you grew up in. How sex positive was your family? How much is society telling you that as a woman you should be desiring sex, right? So sex is biopsychosocial. So it's just to say, oh, I can't be sexually active because I have low hormones, or I am because I do. Like, hormones are just one little piece of it. And I always want to make that very important to people. For the people on Instagram Live who want live coaching, join my email list, get on the webinar that I just shoot out so you can actually do live coaching on the webinar. Those are the only people I'm going to be coaching today. Just another push to get you over there. So yeah, I'd say, the reason why birth control pills work for acne in women and hair growth, hirsutism, is because it lowers your testosterone, right? It kind of blocks that testosterone. So you're kind of like, so, they say like when you play with hormones, right, you get the good and the bad. So you don't get the testosterone sort of side effects, but you don't get the testosterone sort of desire. So you don't get a little bit of the testosterone, right? So it's really, are there other ways to help with the acne and the hirsutism? Spironolactone is another medication that women will use for acne. Works great for it, but they will say their spontaneous desire does decrease on that medication. Because again, you're blocking the side effects of testosterone, and testosterone is the hormone of desire. So it's a double-edged sword. You don't just get one edge of your testosterone sword. What I would do is I would explore other options, see if you can get off the medications, right? And then another option would be talking to a sex therapist, or realizing you are not broken for not having a spontaneous sex drive. You might mourn the sex drive that you had, right? That is now muted because you want the side effects of not having that testosterone. Sometimes just understanding that really helps people. And then realizing new ways to explore your sexuality, your creativity, all of that stuff. So sex therapists can really help with those things. So I hope that was helpful. Here's our next one. I'm breastfeeding on vaginal estrogen for lichen sclerosis. So she's breastfeeding. She's on vaginal estrogen for lichen sclerosis. My OB seems confused on whether it should be applied topically or inserted. She said, why not both? I know you can't give me medical advice, but wondering if you've heard of doing both. So my first question would be, if it's lichen sclerosis, are we biopsy proven lichen sclerosis? Because the experts do recommend making sure it's not something else. So are we certain it's lichen sclerosis? My other thought is, why aren't you on clobetasol, which is kind of the steroid management for lichen sclerosis? And again, I don't know about steroid and breastfeeding, so you'd need to check that out. But certainly just treating lichen sclerosis with estrogen cream is probably under treating your lichen sclerosis condition. I refer you to Dr. Jill Kraft, who's on Instagram, and she's awesome. The Center for Vulvovaginal Disorders in DC, I think in DC, is the lichen sclerosis expert. She knows everything about it. So I would refer you to CVVD, the Center for Vulvovaginal Disorders, Dr. Jill Kraft, Krapf, as the lichen sclerosis guru. Going back to the question of, can I put the vaginal estrogen on the inside and the outside? Yes, absolutely. Two reasons. Number one, when you're breastfeeding, you're breastfeeding the prolactin that your brain produces in order to have the breast make milk, right? Basically puts the vulva into a menopause state. So dryness, pain with sex, decreased libido, all of those things happen to breastfeeding women as a normal way of your body to be like, right now, the resources are going to feeding this baby. The resources are not going to reproducing more babies. Not to say that it's a perfect never get pregnant plan. It's not. You can still get pregnant while breastfeeding, but that is why the vulva basically is like, what is going on down there, besides the fact that you just had a baby, right? Oh, that too. So what you do is you put vaginal estrogen cream in the vagina to help with the vaginal dryness, lubrication. I do think putting it, especially for people who can see my hand, at 6 o'clock on the vulva, because pain on insertion can be very uncomfortable for people when they're breastfeeding. But the breastfeeding dryness, like the menopause state of breastfeeding, does get better once you stop breastfeeding. Might take a couple of months, but vaginal estrogen is safe. It's fine to take while you're breastfeeding. Why not be on it? Like, how about a six week postpartum check being like, here's some vaginal estrogen if you want to be sexually active while you're breastfeeding? How about preventative medicine, you guys? Like, how about we don't have to go in complaining of something? We just say, like, you're just given the preventative medicine option to begin with, and then you can opt out. Why do you have to go complaining of something? I don't know. That's my soapbox. I'll dismount. So that is you can put it on your vulva, you can put it in your vagina, you can do both, absolutely. Going back to the lichen sclerosis question. Okay, next one. Let's take a sip of coffee. Today we are having half calf Nespresso with a shot of caramel macchiato creamer. Literally, caramel macchiato creamer is like my only vice now because I'm really trying to give up sugar in general. Like the pump caramel for the lattes, gave it up. Trying to. Gave up alcohol. Day 63. Caramel macchiato in my Nespresso is literally all I have. So let's take a sip of coffee. Okay, what are your thoughts? Oh, here we go. I've never desired sex. I was married for 26 years, but he had two affairs. I had sex because he wanted it. I have felt broken or not normal all these years because I don't desire it. How can I? I wish there was a pill for it. How do you learn to love your body? You guys, all of us right now, unison joint hug for this mama. Like, she might not be a mama, just lady. I'm assuming female, but you didn't specify your gender. I'm assuming female because just gender stereotype. Women socialized as females with vulvas in our universe who have sex because other people want to. You tend to be socialized as a woman. I'm going to call you a she. Okay, so if your partner had affairs, if you only had sex because your partner wanted to, it's very, very common for you to not think sex is for you, right? If you had that situation for a long time, I highly recommend a sex therapist because here's the deal. You are not broken. You're completely worthy of a wonderful relationship. Your past does not define you. Your past does not define your future sexual opportunities at all. Might actually make you stronger. Might actually say, because of this, I need to get really curious so I can make sure the rest of my life is for me. So I would say sex therapist. As far as desire goes, if your beliefs, and I would pay a lot of attention to your beliefs about this. If your beliefs are, I just had sex because my partner wanted it, sex is not for you, right? If you think sex is for other people or sex is something you do to garner their love, to garner their loyalty, or maybe you had sex and they were still not loyal, right? There's so much there that we have to uncover before we can say, what do you want, right? What could sex mean for you? What do you like in sex, right? If you're just having sex that your partner wants, you're probably having the type of sex that he wanted. I'm going to call him a he. Again, I don't know. But a lot of women kind of get into the he type of sex. The heterosexual paradigm is what I call it, right? So usually means, just to summarize that for people who don't know what the heterosexual paradigm is, sex starts with vaginal penetration. It ends when the male has an orgasm. That is an incredibly lacking paradigm for female sexual satisfaction. Like, make a t-shirt. Nobody gets taught female sexual satisfaction. And what happens is we have women not enjoying sex. Then they say, well, I don't desire this thing. There must be something wrong with me. When the whole time you haven't been having female-centric pleasured sex in the first place. This is the fault of everybody, so it's the fault of nobody, right? Men don't know this, so they can't help. Women don't know this, so they can't help. Hollywood basically shows women enjoying the heterosexual paradigm and doesn't explore activities, what they tend to call foreplay, right? Which is the stuff that like isn't a home run. That's like the second base and third base. That's where all of the energy and magic happens for female pleasure. You must work on that. So going back to my lovely lady who wants to explore, you're not broken at all. You're 100% worthy just as you are. It doesn't matter what happened in the past. You need to hear this and you need to understand. But uncovering what sex has turned out to be for you, so that you can then say, what do I want it to be? What am I okay exploring? Going back to your comment about I wish there was a pill for this, there's a pill. It's called Addyi, philbanserin. Take it every day. It's kind of in the class of antidepressants, but it's actually kind of a crappy antidepressant. And you can take it in addition to your antidepressants. A lot of antidepressants cause low libido. So watch out for that side effect that nobody tells you about. But so there is a pill now. The problem is, if you don't deal with all this past stuff that you're carrying with you, you're going to take the pill. It probably won't work. And then you'll feel even more broken because now the pill didn't work, right? Like you're a medication failure, when really I'd be like, I wish that for you that pill didn't exist until you did that hard work to then say, hey, maybe I just want a little bit higher dopamine in my brain. And that pill might help. Pill helps satisfying sexual events. The problem, there's so many problems. The problem with female sexual medicine is that The pill is you have to measure something, right? Like, how do you objectively measure female desire, right? It's going to be higher at parts of the day, and if you've had good rest and all that stuff. So what they did is they measured satisfying sexual events, which is actually a very different thing than desire, right? And so here we have a pill that's FDA approved for low libido, but really we measured the outcomes of satisfying sexual events. And you can have sex with no desire because desire happens during sex. It's complicated, but for this lady, I wish you didn't know the pill was available, because it will not fix all of your problems when you have that sort of background coming in. So I would say sex therapist first, then prescription medication. Prescription medication is only available for premenopausal women. So I'm not sure how old this person is. She said she was married for 26 years. So if you're postmenopausal, it's not FDA approved. Do we care? No, doctors do off-label stuff all the time, except for the fact insurance doesn't cover. Insurance can say we don't cover any off-label use of these products, right? So it can be very expensive. It's a daily pill. It doesn't solve your problem, right? So it's a daily pill you have to take for life, which you might be paying cash for, which isn't going to help with figuring out your body, figuring out what you want, figuring out what turns you on, figuring out you're worthy and enough and not broken. The pill will not do that for you. That is all. I can do that for you, but you have to do that for you. Okay, that was a good one, you guys. Let's do another one. So, what are your thoughts on pellets? Should I run away screaming? Other options for testosterone? I go see a hormone doctor in August. I know you can't give medical advice, but I trust you. That's so nice. I actually had somebody today, like somebody in South Africa, and she said, I listened to your podcast and I went to my urologist in South Africa and he validated everything you said. And I'm like, well, it's nice to know that I'm legit. But think of all the people on Instagram and stuff that people trust that like don't actually know what they're talking about. Ugh. Okay, so here we go. Thoughts on pellets. Pellets are pellets are not FDA approved. Pellets are not usually dosed specifically for women. You can't reverse them if you have bad side effects on them. They're just stuck in your body until they go away. They're not covered by insurance, so they tend to be expensive. They tend to be involved. I'm stereotyping, you guys. They tend to be involved with a program where you're paying a lot of money to get your labs tested a lot, which, by the way, you don't need to do that. So I think pellets came in because doctors have done such a crappy job at treating menopause, right? So doctors don't know how to treat menopause. We don't know how to treat the symptoms of menopause. So we really don't deal with it. Now, what happened? There's half of our freaking population, if they live long enough, is going to go through menopause. So these kind of clinics popped up doing pellets, basically saying, well, insurance doesn't cover it, so I can just make cash and check labs, which is maybe possibly a little unscrupulous, some people would say. So do you have to do pellets for testosterone? The answer is no. Is there an FDA approved product for women for testosterone in America? No. But there is dirt cheap topical testosterone that's formulated for a man that you can get prescribed to you by just a regular doctor, and you use it at 1/10 the dose. Like pennies to the dollar cheaper. Probably pennies to like the hundreds of dollars cheaper, you guys. So you don't have to get anything put under your skin. You just get a cream, you put it on your leg, and you dose it at 1/10 the male dose to get the female dose. And remember, testosterone is just approved for desire. It's not really been shown to do much else for women as far as our health. Now, there are some people that say, hey, it helps my energy, it helps my stamina, and all of that stuff. So the testosterone, here's the tricky part. The tricky part is finding a doctor that knows enough about hormones that can give you that dirt cheap option. I'm telling you, it's like for a 30 pack, which is what the men is, cash base is $300 divided by 1/10 because it's 1/10 the dose. So it's going to last you 300 days. So it's going to last you 10 months for $300. And that's top, like $300. Pellets are thousands of dollars a time every 3 to 4 months. So like pennies to the dollar cheaper if that's what you want to do. The problem is finding that person that's going to do that for you. Probably, I haven't done the research, but odds are you're going to see the pellet pushers more than you're going to see a doctor who's comfortable doing testosterone. I'm comfortable doing testosterone, but only I'm pretty much like, you have to have seen a sex therapist to figure out your desire reasons aren't for anything else. I'd also like you to be treated for menopause. because there's two reasons, pop quiz, two reasons, the two main reasons that women in perimenopause, postmenopause stop having sex. It's not a dry vagina. I don't know what number dry vagina is. Number one, availability and willingness of the partner. You've got somebody who's on your team that you're interested in, who knows how to make you feel good. You're going to want to sleep with that person. Number two is menopause symptoms. So hot flashes, poor sleep, night sweats. Managing your menopause symptoms turns out you're sleeping better, your anxiety's less, your sex drive gets to go up a little bit. So women after menopause don't stop having, you don't have to stop having sex. Like this whole thing of like, well, because I'm post-menopause, I don't have desire in sex anymore. It's like treating your menopause symptoms, healthy body, adequate sleep, exercise, eating right, mental health, availability of the partner. That's it. You don't actually have to have hormone replacement therapy if you're not having those menopause side effects. It's not necessary. There's plenty of women who can't be on hormones who have great sex lives. So that's why it's so complex and nuanced. Because like hormones help, but if you can't have them, it's okay. It's fine. So here we go. Next one. Oh, so to answer the question, should I run away screaming? If you want to. It might be a little dramatic to run away screaming. I would say get two opinions and see if pellets is right for you. And if you choose pellets, know that it's not FDA approved. And the North American Menopause Society and ACOG, OB-GYN, both of those societies recommend don't use pellets because they're safe FDA approved products that are dirt cheap, that are available. The problem is finding a doctor to prescribe it. Okay, taking a sip of coffee. Hey Kelly, I listened to you on Cat and Nat and it changed my life. Yay! And I stopped blaming myself. Yay! Thank you. She said thank you. I say thank you back to you. Let's see. On a side note, do I have any expertise on PMS? I've been documenting the fights and relationship struggles between my husband and I for a year now. Most of the times I'm writing something down during PMS. Here's the thing. I'm worried if I tell my husband that arguments are during PMS, then none of my feelings will be justified. I seriously don't know what to do. There's also a moment where I feel broken. Would love your thoughts on this and perhaps a podcast or Insta story for other women. Great question. Okay, so I'm not a gynecologist. I don't actually treat PMS. But what I know this is that PMS symptoms are totally legitimate. They're hormone stuff. It's like doing this. It's like going post-menopause and being like, I got osteoporosis. And you're like, well, it's just a hormone thing. It's because you didn't get any hormones. So you got osteoporosis. Like legitimate thing. You're not broken or weak or anything. It's just like I got sunburned because I went in the sun. Like, well, yeah, your son gets sunburned when you go in the sun. Like it happens. When you have PMS, hormones are raging and our bodies aren't able to be like, I need to be super clear-headed thinking on this all the time. Like what I'm trying to say is I love you. You're legitimate. Your feelings are legitimate. Your symptoms are legitimate. It's all legitimate. So I would say, like, first of all, talk to the husband and say and communicate. And maybe not during like a rager, feisty sort of thing, like when you're not. And just be like, you know what? Sometimes I just feel like I just want to let loose way easier than like the rest of the month because I've got this probably like testosterone surge going on or a massive progesterone drop. Progesterone mellows people out. Progesterone's like the mellow thing, and then testosterone's like the rage thing. And then think of like that change. All this bullshit about hormones being balanced, you guys, like you should see what happens to women's hormones when they're having like hormones. From puberty to menopause, it's literally no day is the same. So that's what our bodies have to do in order to like try to reproduce. It's not our fault. It's like a blessed thing. We can actually create humans. God love us because of that. It's amazing. Okay, so totally legitimate to have these problems. I would tell your husband, and just because, you know, he might want to know that you don't want him to take it personally, or he might want to know like how he can help. Most guys like want to know this stuff. They didn't get taught this, and they also didn't get taught like to shame us or not shame. Like they just all need to know this. I love what you're saying, but I just wish people would just stop saying, oh, it's PMS. I hate when I'm losing it, and you know you are, but you can't stop the train wreck. I would work a lot on, that's a great comment. I would work a lot on like seeing what you can do. If you're like, okay, the time is right for PMS, what you can do to kind of help that. Are you taking care of your stress? Are you taking care of your sleep? Are you taking care of your health? Some people have like amazing sugar cravings and eat poorly during it. Like, what can you do to modify it? That's what I would go for. Do I need to journal? Do I need to be able to just like acknowledge when the trigger's coming and walk away? Like there's still so much within our control that I would pay attention to that. Other options are just medical options that are available. And you can talk to your OB-GYN about it or primary care physician, is you can be on just very short acting birth control just for a little bit of the month, just for PMS. You can be on a very like short acting temporary antidepressant that kind of mellows it out for PMS. So there are medical options. If you're like, I've tried everything, I've tried all of that self-care stuff. Scottish Girl says a padded room might help. Yes, you can say that in the comment. I'm not allowed to say that. You're like, I just need a 5-day meditation retreat every month. Sorry, not sorry. I'll put it on your credit card. Is that fine? That'd be great. Husband's like, great. You're like, great. Everybody's happy. So yeah, there's self-care stuff you can do. There's medications you can do. I certainly would communicate it. And it's not a personality flaw. It's like literally hormones. Okay. But I get that comment. I get that comment of just like dismissing it and being like, oh, it's just PMS. Of like, you still have some control. You can't make your hormones not like do wild swings, but you can control what you can in that environment would be my advice for that. Okay. Here's the next one. Do you need a prescription from the doctor for vaginal estrogen? I keep getting UTIs. I'm 54 and in perimenopause. 54, you might be heading towards menopause. Average age of menopause in America is 51. So you might be end of menopause at that point. Yes, you need a prescription. It is a hormone. That's why you need a prescription. All hormones, that's an overstatement. Many hormones are prescription. I'd say, all that like progesterone stuff you get on Amazon. We can't say there's actually progesterone in that, you guys. You know the data on supplements, right? Data on supplements is they took a bunch of supplements and actually like looked at what was on the packaging and then studied the product to see if it was actually in there, and it matched up about 60% of the time. I hate to break this to you guys, but you guys are smart and intelligent. If you put all your dollars in these supplement things, just know that placebo, Dr. Lori Mintz just told me this because I just interviewed her for my podcast. Dr. Lori Mintz just told me that the placebo effect in female sexual health studies is 65%. I'd always been quoting 40% because in the male Viagra studies, it's 40%. So like I'm telling you, the brain is the biggest sex organ, but you like put a pretty package and you say it's progesterone and I slap the cream on my wrist. I'm like, I'm sleeping so much better. Like placebo works, you guys. And these companies don't actually have to put in the product. That's what's so great about FDA approved products. Like it's legitimately in there. They had to do all the testing. So do you need a prescription for the doctor for vaginal estrogen? Simple answer, yes, absolutely. Just go. There's so many studies. Give them my podcast. Just did a podcast on estrogen cream and urinary tract infections. Give that to them if they don't want to give it to you. It's preventative medicine. It is literally sunscreen on a hot sunny day, vaginal estrogen. Okay, here we go. Thank you. I turned 50 last October, and I've asked my female general practitioner and female gyne before I turned 50. And after I turned 50, if I needed to have my hormones checked, and they both said no, unless you're having problems. Well, I didn't know that itchy skin, extreme fatigue, no energy, sleep problems, anxiety, joint pain were all symptoms of menopause until a friend turned me onto your podcast. Thanks, friend. And I had mentioned all those symptoms to my doctors over the last 2 to 3 years. Not one person ever said the word menopause or hormones to me. Side note, it's because we didn't get taught about menopause. Like, sad but true. Here's how you can help. All of you, stop being so effing afraid of estrogen. Like, that's the public health campaign we need. Stop being afraid of estrogen, and then we'll start giving women estrogen, because you have to be open to getting estrogen. So stop being afraid of it, because it's not dangerous. It's not more dangerous than taking a statin. It's not more dangerous than taking antibiotics. Do you guys know there's data showing that overuse or a lot of antibiotic taking is associated with breast cancer? Why are women going in asking for antibiotics for like everything that doesn't even need an antibiotic? There's a risk of breast cancer in taking too many antibiotics, right? My whole point is stop being so afraid of estrogen, because it's not the only thing that has side effects. So here we go. I digress. I had a visit with my gyne this week after having my labs checked, and my estrogen was 0.1. That's low. Yes, of course it is. You're 50. Average age of menopause, 51. I've now started an estrogen patch and progesterone pill. Awesome. That's great. She wouldn't give me any vaginal estrogen cream until she examines me, so I have an appointment next month. Here's my question. What can I do, say, or take with me that will back up my request for vaginal estrogen cream? I don't want to come across like I know more than she does. Don't worry about coming across as knowing more than they do. Like, you can do it in a very like loving, team-oriented, like advocating for yourself sort of way. You can say, I hear it helps with sexual function, which is important to me. I hear it helps prevent urinary tract infections, which is important to me. If you're already on the hormone stuff, oh, the other thing you need to know is being on estrogen patch and progesterone pill, it's still really stinking low hormones, you guys. This isn't like 32-year-old hormone levels. This is still like really low. And that's why 50% of the time it isn't enough to get those hormones into the vulva and vagina, and why frequently women who are on hormone replacement therapy still need to supplement with vaginal estrogen therapy. So take all of that to your gyne. I think it's very fair that she wants to examine you just to make sure nothing else is going on. You can have a conversation about your bladder. You can have a conversation about your sex life. You can have a conversation about your any sort of prolapse or anything going on, or infections. So like that's legit. But I think to not give you vaginal estrogen, I would really want to know why, especially with the data that supplemental hormone therapy is still so low dose that it doesn't always get down to the vulva. The vulva and the vagina are like the last step on the train. So sometimes you just don't have enough hormones to get all the way to the end of the train. Okay, that's that. I hope that helps. Here's the next one. Thank you so much. I was never so excited to start medication than I was this week, all because of you and other doctors that have been on your podcast. I have power listened to your podcast. This is super funny. I just started the first episode in April 2021. I had to start at the beginning because you can't start a book in the middle. So my OCD wouldn't let me start a podcast in the middle. I love it. That's super funny. I hope you can answer my question on your live. Let's see. I think the question was the other symptoms like vaginal dryness, stress, incontinence, bleeding after sex, she thought she had to live with. So I want you to go get estrogen cream. It's going to be great. 53, this is a great question. 53-year-old postmenopause, take estradiol and medroxyprogesterone acetate. Microprogesterone did not work because I bled even at a higher dose. Concerned about risk with synthetic progesterone, valid concern. Great, fantastic freaking question. Oh my God. Thank you for being here. So the Women's Health Initiative study, which is where the big fiasco came from, that estrogen causes breast cancer, was only in the combo estrogen progesterone or medroxyprogesterone acetate arm. They just used one type. They had everything standardized. So it was standardized estrogen, standardized progesterone. So just from that, we know, hey, estrogen doesn't actually cause any increase of breast cancer because they had no increased risk of breast cancer, the estrogen only. You get to be estrogen only when you don't have a uterus. That is like side bonus of having a hysterectomy. Not that you want to have surgery for a bonus, but like bonus, no uterine lining, don't need progesterone. You need progesterone because we know that unopposed estrogen can lead to the lining of the uterus to be thickened, what we call uterine endometrial hyperplasia, and there is an increased risk of endometrial cancer. Increased risk is 5 to 10%. Doesn't mean there's a 10% chance of getting it. It means your risk over women not on that is 10% increased risk. So it's still pretty low, but it's enough for all the medical societies to be like, we know that the estrogen cancer or the uterine cancer goes up, so we got to protect it with progesterone. There's your backstory. So since then, they've said, well, is it the type of synthetic progesterone used or are other progesterones safer, right? So there's some evidence to say, yes, we're not seeing it as increase of risk, but I have two thoughts for that. Number one is the Women's Health Initiative was never created to look at risk of breast cancer with hormones. The Women's Health Initiative was created to look at, if we take these women who haven't been on hormones and we throw them on hormones, are we going to protect their heart more than if we didn't? That's what it was studied for. So then you've got the placebo arm and the medroxyprogesterone estrogen arm, and they were never, what a normal study does is they weight them equally for their risks of breast cancer. Okay, so we didn't have that. So what we know is the placebo arm was actually super low risk of breast cancer. And it looks like the combo pill didn't actually have a higher than background average risk of breast cancer. It was just that the placebo group was so dang low. Why? Were they younger? Did they exercise more? Like, who knows, right? So to say that it's the synthetic progesterone is kind of making a couple of leaps on that, because that study, which scared the crap out of everybody, wasn't properly made to make the placebo arm and the combo estrogen progesterone arm equal going in. So we're extrapolating from a way, if you made a research study and you said, I want to see if progesterone causes breast cancer, you're going to make the placebo arm and the study arm as equal as you can going in, right? So like all the people who have sisters with breast cancer aren't just going to be in this arm, right? So you got to make it equal. The other option for you, just going back on there, the other option for you is an IUD, which I think is very underutilized. But there's really low dose progesterone IUDs now that also protect the uterine lining. And we think is just to protect the uterine lining. It's not enough to actually get into your system, which also might lead to a lower risk of breast cancer if progestins cause breast cancer in the first place, which you can argue. So that's what I'd be like, consider if an IUD would be work. Then you could be on an estrogen patch and an IUD. The other thing about IUD is you don't have to do anything. It just sits there for like 5 years. Obesity and hormone replacement therapy for menopause, counseling tips for pros and cons. I think it's a great question. So obesity in and of itself is not a contraindication for hormone replacement therapy, but obesity itself does increase risk of blood clot, right? It does increase risk of breast cancer. It does increase risk of diabetes. It's got its own risks as far as the aging woman. And so to me, it would be like, if you want to do everything that you can to be as healthy as possible, let's get your body moving. Let's talk about food choices. Let's talk about addressing that modifiable risk factor, because if you're adding estrogen and progesterone, you're not adding too much as far as risk of blood clot goes. It's certainly way less than birth control. And we give birth control to overweight people. We don't say like, you don't get your birth control until you lose weight. We don't say that to them, right? Because the risk of being pregnant when you don't want to be is way worse than the risk of the oral birth control pill. But we know it increases your risk of blood clot, right? It has its own risks. So I hope that was helpful as far as I go. So I would just say it's part of it's like you're choosing hormone replacement therapy because you want to be the healthiest you can be. So let's also have a discussion about being the healthiest you can be everywhere else to lower your risk factor. I'm 54 and I take progesterone and DHEA as estrogen cream, something I still need. I'm assuming Dottie is an estrogen. It depends. Again, 50% of people will still need vaginal estrogen even when they're on systemic hormones, because it's still such a low dose. It doesn't always translate down into great vulvar and vaginal coverage. So that's what I would say about that. Say, it depends. If you're not having any symptoms, maybe you don't, but I think a lot of atrophic changes happen slowly over time. So even going in to see somebody preventatively and be like, can you just look at my vulva? But go to somebody who looks at vulvas all the time, because I wouldn't say that even the average general practitioner can tell you if it's atrophic or not just by taking a look. So, but certainly if you're having dryness with sex, pain on entrance, urinary tract infections, overactive bladder, nocturia, urinary leakage, estrogen cream in the vagina is probably something you would want to consider. All right, guys, let's see what else we got. I've been on a progesterone pill from a compound pharmacy prescribed by a doctor, an estrogen cream. I'm struggling. I don't know where to turn. I'm always bloated and feel awful. I work out, eat good, stay hydrated. Nothing is helping. You know that progesterone slows down gut motility, and the progesterone might be why you're feeling bloated? Possibly. So I would say get off the compounded stuff too, because we don't actually know. The problem with compounded, you got to trust your compounding pharmacy. It might be exactly what they say is in there, or it might be higher, or it might be lower. It's just not as approved. I would say, why are you on a compounded product when there are FDA approved products that insurance covers, right? So that would be my first thought, especially if you're having these unexplained symptoms and you're like, I don't know. Like, A, compounded product. B, progesterone causes slowing of gut motility, and that might be where your bloating's coming from. Certainly just being postmenopausal can cause bloating as well, right? So making sure you're on the proper dose. So all those things I would be looking at. So I saw 2 OB-GYNs and I went to a doctor that specializes in bioidentical. I can't remember what you mentioned about bioidentical. This is what I mentioned about bioidentical. Bioidentical is just a marketing term. Like, if I can get you to come to me because I hang bioidentical above my building, like that's what it's for. It literally means like just the hormone that is in your body, it's similar to. Like that's what it means. We have FDA approved insurance covered products that are bioidentical. That's the crap of a bioidentical. People think it means like better, or people think it means like natural, or people think it means like lower risk. Like it doesn't mean that. It's just marketing. Like there's literally FDA approved insurance products that are bioidentical. So like why are we thinking bioidenticals any different? Do-do-do-do. You did take my. It says, "Hey Kelly, did I miss your take on PMS? I tend to fight with my spouse more during this time. Am I broken?" Yes, you missed it. I'll post the video. I'll post the podcast. You can go watch it again. And no, you're absolutely not broken. This is super common. It happens to women all the time. You're not broken at all. This is the price we pay for having the bodies that like create humans, you guys. It's amazing. But like they have to do their crazy hormone shifts because otherwise we wouldn't have like a uterus that would hold a baby, that would have an ovary that would only spit it out once a month. Like it's like a freaking symphony in there. And sometimes like the percussion system is like super loud. So sometimes it's goofy. But no, you're not broken at all. Okay. That was the question about bioidentical hormones. It's just marketing. I'll hang bioidentical above this podcast and this YouTube, and like I'll get so many more views. That's what I should start doing. Bioidentical Casperson. All right, guys. So if you want to come on and get coached next time, get on the email list so that you can get my webinar link in the emails, and then you can type coaching, and then I'll pull you on for coaching. But unless you do that, I'm not doing it on Instagram. So this is my live July podcast. I love you guys so much. I can't wait to do this again in August. When you hear this, you're going to actually, it's actually going to be August. So happy August to you. I hope you guys have hot summers that aren't too miserable. All right, my loves. Until next time.